All right, so I saw you 3 days ago.
Right.
And last time I saw you, you were pretty tight, but loosened up very well during the session.
Yes.
And then after we loosened up, we got nearly all of the range of motion back.
Yes.
And then we followed it up with some strengthening. So tell me how all of that felt after I left and the next day or so.
I would say it was sore, like muscle sore.
Where at?
More through, I'm feeling it here. I don't know
Good.
why.
Okay. Yeah.
Here. And then my legs, I didn't have it like I did 2 times ago.
Good.
It wasn't here.
Good. Was the toe okay?
Yeah, it wasn't.
Because we did the lunges and I was a little concerned, but that's okay. Okay.
No, I did wear tennis shoes all day Saturday, which is not normal for me to wear tennis shoes.
Okay.
But the girls have basketball games. And
How'd you do sitting in the bleachers?
I did well.
Good.
Yeah. Now on Thursday, Aniston and I are going to drive down to Lakeland because the girls team made it to the Final Four.
Cool.
So that will be a test because it'll be a 3-hour drive, an hour and a half in the bleachers, and then a 3-hour drive home. So that's a lot.
It is a lot for anybody.
Yeah. So we'll see.
We'll see. Okay, so you were you more tired and sore in your lower back? Okay. And then the leg was okay?
Yeah.
Okay. And then the weekend, how'd that go?
Nothing strenuous outside of, laundry. I didn't clean out a garage again.
Good.
So yeah.
Good.
A lot of walking on Sunday.
Very good.
But that was nothing out of the ordinary.
Great.
Yeah.
And just today, you've been doing a lot of rearranging.
Yes.
And how is your back feeling?
It's hurting right now.
It's hurting?
Yes.
Okay, how so?
It feels like I want to just stretch. Like this feels good.
Okay,
and
stand.
I did see patients this morning.
Okay, so you've kind of hit double whammy.
Yeah, I've
Turn
done
around
a
for
lot
me.
today.
So tell me the area.
Right here.
Okay, and then would you say it's that similar area that you were sore after our last session?
Yes.
Okay, so that's a very common presentation for just like a tired lower back.
Yes.
Right, so if you do a lot of stuff on your feet, lifting, and then as we're up on our feet, like these muscles are firing all day long to keep us upright. And improving the lower back strength and endurance is our secondary goal with all of this, right? As well as the leg, but they go hand in hand.
Yes.
Okay, so you're tired and achy sore here.
I am.
And then how's the leg feeling?
The leg feels okay today.
All right, let's check the
Now,
range.
this morning when I was on the floor doing therapy, again, this side was just, I couldn't find comfort.
That side.
Yeah, and it's only when I'm sitting on the floor. I'm like right now, that side doesn't hurt at all. But I don't know if it's more hip because it's it radiates.
Yep.
And so then I was trying to be conscious of like, okay, why are you sitting? What are you doing? But
Okay. And then how the left leg feel?
good.
Good?
Yeah.
Didn't feel limited on the floor?
No, I was having to move the right more than the left. to get
Okay.
more comfort.
And that uncomfortableness in the right, where was that?
It kind of just goes right here.
Does it feel like
And
it's...
so if I'm sitting Indian style,
Okay.
that's where, and then so then I was like, okay, well, you're rotating. So what if I was trying to just shift.
Sure.
And then I was doing this on the floor, and then I was doing this on the floor.
Yeah. So the left leg wasn't limiting you, and then that wrapping around discomfort, did it feel like it was coming from your back? Did it feel even tied to your back or separate?
I would say it's tied to my back.
Tied to your back, but
Yes.
not like right now when your back feels achy,
No,
not having
I'm not
that
having
hit.
any here.
Okay,
No.
okay. So let's first check the left leg,
Okay.
right? We've had some really good success, and you worked on it a little bit since the last session, so I want to see how it looks today.
Okay.
And then we'll dive right into, I want to look at the right hip and then focus to the lower back.
Okay.
Okay? So go ahead and have a seat. Okay, I know it's on the other side, but just kick out this leg. Let's see where this one's at.
Yeah.
Easy breezy stuff. And then this one. Okay, a little tight.
It's like right tight there, and then once I go like that, it's fine.
And it's gone.
Yeah.
Okay.
I guess that's that on off.
Yeah. And then we had talked about last time too, is that, I know when you lay on your back and you use the strap for your nerve glides, but now we could do the nerve glide in seated.
Yes.
Right? More of the slump.
And I tried doing that last night before I went and got on the floor.
Oh, great.
And I was like, I just need to just knock this out
Sure.
and see if I can give her some relief.
So yeah, I will tell you that if you try to do this on the couch or a really soft surface, it's not quite as good. Like the firmer surface is better. Like this table is really well. But let's see if we can loosen it up without me doing it to you. Okay, so What I'm going to have you do for this nerve glide, let's just see the sensitivity of it. So stand or kick it out, feel it. Okay, pull your toes back. Do you feel it more or less?
Less.
You feel it less into the hamstring? Okay, any change in the calf at all?
Tightness,
just
but not
tightness,
discomfort.
not discomfort. Okay, and then come back down, and then I'm gonna have you kick out again and where you feel it, right there. And then now get really bad posture. I'm gonna keep this leg here, but slump all the way down.
Ooh, that's what you did when I first met you.
Yeah, and then that lights it up.
No, it lights it up big time.
Okay, come back up. Okay, so what you're going to do is the first set here then is that you're gonna kick out your leg and just pull back your toes. And pull back your toes. Good, and back down. We're gonna do 20 of those like you do when you're laying on your back, but kicking your leg out and pulling back your toes with really good posture.
Do you want me to go beyond the pain to like right there where it releases, or stop at the pain?
So for you, because you've had this stuff for a long time, and we could do pretty much as we want to it and you're not sore.
No.
I say we gotta go past it, right? So just kind of work through it here. Really good posture and positioning. Pull back those toes. And now we're just improving the, some of the nervous system and how it moves within our body. And it feels good. You should notice it start to loosen up, where you can kick up further and pull back more, and it should feel less intense. And I like this because you don't have to lay on the ground to do it. It's a little bit more applicable to things we do in our life. Okay. What number is that?
This is going to be 17.
Great. I'm glad you're counting. Great. Mine loosened up. Like I felt like I was good to go, and I don't have any of the back pulling.
Tension in my back.
You can still feel tension in your back?
Back here.
Oh, yeah. Yep. Okay.
Yeah.
So now what you're going to do is we're going to do the whole system now. And so we don't want to pull the system too much because you still really felt it with that. What we want to do is glide it. And so we're going to keep our toes pointed down. But then we're going to go in bad posture, and then once we feel it, we're going to come back up. Okay, toes pointed down, bad posture, and come back up. How's that feel?
Fine.
Okay, do you feel any of that tightness?
Not as much as I did when I was doing pull towards me.
Okay, so we'll do 15 or 20 here. So now we're just getting the back and where the nerve originates ready to be worked. Feeling good? You can start to feel your quad working a little bit, right? Start to feel those quad muscles wake up. Yeah, don't be afraid to come even further down.
Ooh.
Yeah.
My gosh.
Yep, it makes a big difference coming into that bigger slump position.
And once I point it.
Yep. Right, we want to get that whole spine ready to go.
Big difference.
Good. 2 more. It's all self-guided though.
Yes.
Right? So I want you to feel it in like an intense pull or stretch, but then it should relieve completely.
Yes.
Okay.
It does, but when that's up and unrolled, it's very tense.
Okay.
Yes.
Very good. And then any symptoms right now?
No.
Okay. Kick the leg out. Any other than the quad a little bit tired, any symptoms at all?
No.
Zero.
Zero.
Awesome. Okay. So that's where you are now, right? So the next step would be pulling the toes back and really bad position, our posture, okay? But now what I want you to do is just keep the toes relaxed and then go down into your bad posture and then come back up. So that's where you're at now. Now it's a little bit more weird. Now this is just for the leg symptoms, right?
Yeah.
You're tired, achy back right now. May have some relief with this, may not. It's hard to say.
I mean, it doesn't feel bad on my back, but man, does it shoot through my hamstring the minute I roll.
Just for fun, let's try the other side. Let's see how it feels.
Fine.
No problem at all.
No.
Nice. It's crazy to feel that difference, right?
Oh, yeah.
It's wild. And I would say you don't really know, like, unless nerve pain's hard to explain,
yes.
right? And what you're feeling is a nerve pull, like that nerve is waking up because you're tensioning it, which it's normal, right? It's very normal to do. Like this is mimicking you bending forward,
yes.
Except you're seated, and so it just needs loosened up.
So I wonder if I would have relief when I'm sitting and I have that discomfort if I sat up better.
Relief in here?
Mm-hmm.
Yeah, potentially.
Potentially.
You'll probably have more relief if you're able to whip out 15 of these bad guys.
Right.
But if you're not able to, then, kind of working into that.
It doesn't mean that I couldn't do it right before that client shows up.
Exactly. Yeah. Or if you wanted to have more an erect back, and so it gave you less symptoms, that'd be fine too.
Okay. Okay.
But the nervous system is made to go throughout that range, and so we want to work back into it.
Yes.
Okay.
All right.
That's your next step.
Okay.
Is doing the little bit more of a poorer posture. Now, when you're laying
so
up,
I'm not doing it with the strap anymore. I'm just this one I'm not doing with the strap.
Yeah. So the limitation with the strap is that it's great in the beginning because the only thing you move is your leg.
Right.
Not when you're at now, when you've made some recovery. Now we have to move the upper part of your body,
in which that's where I get more pain.
In which seated position has always been more problematic for you, and so we're there now because you're responding so well to the strap.
Okay.
Got it?
Got it.
Okay, so now what we're going to do is just go ahead and take a self-assessment of your lower back and your leg, and I'll have you bend over and just see how you feel. Come back up. Good. How are things feeling?
I would say I have a little bit of relief through here.
Oh, okay, cool.
When we first started.
Oh, cool. Yeah.
Everything around. Yes. Hamstring doesn't feel as tight.
Okay.
I mean, this feels good.
Feels good.
Yeah.
Okay. It looks good.
Okay.
It looks really good. Okay, so let's go ahead and try to get in your cross-legged position on the table, like you sit on the ground. Like you sit cross-legged position. I want to see what that right hip looks like and feels like to you. Do you feel anything in the right hip?
No.
So is it mostly after you hung out there for a little while, then the right hip starts to?
Within, think about this morning, like 15 minutes.
Oh, okay.
I mean, I was in my first session, and it's before the session ended.
Got it.
And it's a 30-minute session.
Okay. And do you usually start in this position and then get out of it because of the right hip?
And then I do this, and so the child's here in a chair. Or I'll be like this.
Totally.
Or I'm like this.
And then that's when you start to feel this stuff.
Yes.
Okay.
Yes.
Okay. Makes complete sense.
Yeah.
And so this is...
I feel a pull right now.
Okay.
But not pain.
And not on your left side. Great. So I want to check the rotation range of motion of your hip. So lay on your back. So this external rotation range is that position of the hip. So I want to check it out here. Straighten this leg. What do you feel there?
I feel like tension, like it's not wanting to go, like it's gonna fight you.
What you typically feel. What do you feel there? Anything?
I would say more discomfort.
More discomfort as well. Yeah, I'm gonna check the other side. So a little limited in that external end range and internal rotation.
That doesn't bother me at all.
I feel good. Good end feel there. Ooh. Yeah, you have got a ton of range here. That's really good. All right, go ahead and sit up on the edge of the table.
Is it typical that I would have so many issues on opposite ends?
It's not atypical. I think it's just your body.
Yeah.
Okay, so to check that range of motion, this is kind of neat because we'll be able to see this. And so external is kind of bringing that foot in this direction here. So right there, don't let
Crossing over?
No, don't cross over. Don't let that knee come off the table because you kind of want that true range of motion. What do you feel there?
Like just tension, like a rod, like a rubber band.
And then the other way, this way, the internal. Ooh.
That hurts.
Hurts?
Yeah.
Here?
Yeah.
Okay. Let's, just for a little comparisons, try the other side. So go in like that. No issue. Okay, and then go out. Lots more range. Like, I know you're compensating a little bit, but that's okay. We can see the big range difference here. So, okay. So globally, this hip is a little stickier.
Yeah.
Okay. All right, on your back again. So we're gonna do a little treatment in there. This is where I get my hands dirty because the hip is a big joint.
Yes.
And I have to put some oomph into it.
Okay.
Okay. But we want to figure out, is this more muscular limitation or joint limitation? Okay. So I'm gonna bring you into here. What's that feel like?
It's like discomfort.
Yeah, sure. Where?
I mean,
where?
right here.
Okay. All outside?
Yes.
Okay. How about when I do
Like now I
that?
just went into my butt.
How about when I do that? Any issue?
No.
Okay, that's good. That is really good. Still feel it?
Once you get past it, then it's fine.
Mm-hmm.
That's just uncomfortable.
Mm-hmm. No problem down there. No problem there. All right, so we're going to do this little test here. That ankle's going to be there. Let this knee fall towards the table. What do you feel?
Relief.
You feel pretty good?
Yeah.
Okay. Stay there. I'm going to give you a little push into that. What do you feel there?
I feel like I want to fight you, but just acting more fear.
Okay. Let's see the distance. So let's try the other side. The distance to the table with that. Ooh, about the same.
Yeah.
Okay. Do you feel about the same on this side?
Yeah.
Okay. Yeah. Very good. So it's really seems more muscular limitation at the hip, which is good. So what I'm going to do is just dive into that a little bit here.
Okay.
And you should feel this into your spot.
Okay.
What do you feel?
Oh, right to the spot.
Discomfort? Yeah. Good stretch? What?
A stretch.
Good stretch? Okay.
But I could feel like stretch and then like that isolated spot.
On that side? Mm-hmm. Okay. I'll go out a little bit more. How about right there?
Same thing.
Same thing? Mm-hmm. And how about when I go in a little bit more?
That doesn't bother me.
Not nearly as bad? There?
No pain.
Okay. So we're going to dive into this external range here. I want a good stretch. Feel it?
Oh, yeah.
So the key here is like if we work into this muscle, these muscles, and we notice that that feels a little bit better when we do our testing again, then we need to start getting into some strengthening with those deeper ranges to relax and stretch those muscles and get them more tolerant of the sitting position. Good stretch. I'm not holding back.
No.
The hips are big joints and you have to put a lot into them. Feel okay? Very nice. How's that feel?
That feels good.
Okay. All right, do a little leg pull here. Just relax for me. You might feel a little release in the hip. And this is for inside the hip, but okay. I'm gonna go back out here. What's that feel like?
It's okay.
Is that all right?
Okay. It's not pain.
Okay, stretch. Good. I'll get you at that end range here. I love it. You all right? All right, so that works into the internal or the external rotation range.
Okay.
So what I'm gonna have you do is you're gonna sit on the edge of the table again, and you're gonna, or just sit in the cross-legged position again and see how that feels.
Feels good. Doesn't hurt.
Doesn't hurt? Okay, and then what I'm gonna have you do is try to sit up in really tall posture. How about that? Any change there?
Pressure, but not pain.
Okay, and then slump it down.
Nothing. No
Better?
change. Yeah,
Is it better?
actually, yeah, better.
Okay. Yeah, so it makes sense. Like there's a reason why it's called the lumbo-pelvic complex, and there's such a relationship between them. And when you go into that tilt coming forward and arching up a little bit more, it actually decreases the space a little bit in the hip joint.
Yes.
And so all of it's kind of in play.
Okay.
It's kind of in play. So are we stretching your hip flexors? Are we working into your hip flexor mobility? No. Okay. So we're going to add some of that because that seems to be where you're at right now.
Okay.
Okay. So we'll get into that. Sound good? Good. All right. So we're going to go into the pigeon pose. You know what pigeon pose is?
No.
So you're going to like it. It's really good. So you're going to you could use the table.
Okay.
And essentially what you're going to do is that right leg's going to be in front of you, and you're going to lean into that right leg and that hip. Yep. You're going to lean into it, and you want to feel this in your buttock or your spot. It could be either. You feel it?
Yeah.
Now, the key here is you can change the position just by changing your arms.
Yes.
And kind of
I want to go this way.
Okay, you go where you want.
That's what I want to do.
Yeah, listen to your body. See how it feels. Yeah.
Like I feel that's a bigger stretch.
Okay, I want you to kind of unlock that external rotation range. So you're going to kind of rock into it up and down. Now, on the floor, this will feel just like this. Okay. You could do this. I like doing it on my table because you don't have to get on the floor. So working into that external rotation range. Feel okay? How's your back holding up? That achiness in your back?
It's not bothering. I'm not bothered by it.
Okay, good. Ooh. I can tell my left side is a little sticky. Feels good, right?
Yeah.
Do you have any symptoms down the left leg right now when you're doing that? Awesome. Okay, come out of that position, just kind of stand up, a little self-assessment.
I don't know. I don't feel pain.
Okay.
I feel like I've worked it.
Okay.
Yeah.
Get in the same cross-legged position. Let's see if we're...
Crisscross?
Yeah.
Applesauce?
Crisscross applesauce, that's right. See if we're better, worse, the same here.
I don't hurt.
Okay.
Yes.
Does it feel better, worse, the same than we started?
I would say better than when we started.
Okay.
Not worse.
Could you tell that pigeon pose got into that area?
I think it did.
Okay.
Well, I think all your push it in helped it.
Yes, and so with the hip, I like using your own body weight to unlock it. And so getting in there with your body weight
So
is...
how do I do that on the floor, though?
Yeah, you just go ahead and get on the floor. Yep. Yeah, so that you want to try to get that left leg kind of behind you.
Oh, wait.
Behind you.
My left leg?
Yeah. There you go. Now come this way with your hand. There it is. Yeah.
Oh, yeah.
Feel it?
But that's something I can easily do when I'm actually working.
Yeah.
If I'm on the floor, I can... 1 minute.
Yeah, 1 minute. Yep. And so there's a good place to start. But then as you get more mobile, you could sneak that left leg straight behind you. And then that will get you even a bigger pull into that hip.
That actually feels better.
Yeah. That's awesome.
Okay.
That looks really good.
Okay.
And again, you can still change your hand position to kind of feel...
And I can go...
Your preference. Yeah,
Okay.
your preference.
Okay. The
Now,
goal is to go over the knee.
Yeah, so hitting the external rotators is this this range here. Okay, if it starts to sneak around into your groin, that's different.
I haven't had that.
Okay, perfect.
It's very isolated.
Good. So
I'm used to that discomfort. It's either hamstring or that isolation.
Good. How you feeling right now?
Pretty good.
Okay, very good. So the big thing to follow this up with, so that gives you temporary relief, right? If you want to change the tissue itself, its actual length, we need to get some strength throughout that range as well.
Okay.
Okay, and that comes with the strengthening. So that's when we worked on the lunge, right? So I want to do the lunge again, but now I really want to start sinking down into that full range of motion. Okay, because you are getting better.
Yes.
Right, and so, oh, good. It's a good place to start. How'd that feel?
Fine.
Good.
What did I do wrong?
Just try to stay super tall for me. Yep.
Okay.
Because it's going to make you sink into that hip more. I know this is your left side. What do you feel there?
I don't feel pain. I just feel like I have no strength on that side.
Yeah.
Like it's just not doing.
On which side? Which side
this
feels?
side.
Okay.
When I go down.
Yeah, it's interesting. Like your right side tends to be a little bit weaker, but your left side has the
Right.
stuff. Okay. Keep going. I'm okay with that form. How do you feel like you would do if you didn't have this table?
Oh, I'd be on the.
Just because it's weak.
Yeah.
Okay.
Yeah.
Try to get a few more inches into the stride, a little longer stride. There you go. It's super exaggerated, and now go down. There, that's better. Come back up.
That's gonna hurt when I do it from my other side because my toe.
I'm curious about how your toe is going to do. Let's check it out.
Okay.
This is where things get a little tricky. Your foot just comes straight up.
My toe is like not happening.
Yeah. The thing is, it's a hard, bony.
Ooh, man.
Does it hurt?
It does.
Okay, that's the first time
like
it's
a
hurt.
stop.
Yeah, it's a bony infield, which
Yes.
means we're running out of space.
Yes.
Which will make this a little bit more challenging.
Do you think it'd be different if I had shoes on?
It would feel better if you had shoes on.
So
It
I
would.
do it with shoes.
Yeah.
Okay.
I think it would feel better, but remember I told you like the adaptation we can do is the lateral lunge because it still works a lot of the hip, and you don't have to bend your toes at all.
Yes.
So let's try that.
So this one?
Yep. So come back up. So this is the trickier one in that when you step, you want to sink down and back. I know. Yep. So that's a squat.
This.
Okay, come back up. That was better.
Okay.
So take a step with your right foot in, now left foot out, big step, sit your butt back and out, and the right leg stays straight. There. There. Now press back to the middle. Both feet to the middle. Now you should feel the inside of your leg pull, and you should feel your butt activate.
Yes.
Keep going. Right there. Now press back to the middle. That was perfect.
Okay.
So no toe range of motion required. And you can still sit into that hip range.
Yes.
It doesn't loosen up the hip flexors quite as much, which we'll just add on then.
Okay.
Keep going. You should feel the inner leg and you should feel your buttock. But yeah, that's good. That's really good. How's your back feeling?
When I do this, it feels good. It like pulls it.
Okay. As I said, this directly strengthens the lower back as well. Any symptoms down the left leg?
No.
Great. Great. And now the little crackling that we hear is fine, right? We're not worried about that. It means you've had some days on this earth, which is fine. Keep going. You're getting the form down, which is good. So one leg straight, the other leg bent. Yeah, I love that you're leaning forward so much, which means you're getting deep into that hip.
Yeah.
Which is good. Really good. Okay, a couple more here.
Goodness, I grind.
That's all right. Okay, come back up. That's really good. And so you're stronger than you think. That's hard to do.
Yeah.
Right? You're getting a lot stronger too.
Yes.
So doing that on day one you would have been sore for a few days. How you feeling right now?
Pretty good.
Good. So let's work on the hip flexor then. So I prefer to have some sort of pad. A pad or something you can
like
kneel.
a table pad?
It's something you can kneel on.
Oh,
Or a pillow or. It's really for your comfort. So. Yeah. Oh yeah. Of course. That way we both have some comfort, right?
Pediatric clinic comes in.
Yeah. Great.
Andrew just left it in.
Oh, I hate to dirty it.
No.
All right, let's fold it in half. All right, we'll use my table as well.
Okay.
Okay, so kneeling position. Nice and tall. And then what you're going to do is just bring this leg forward more. See how far this is from myself. Stay nice and tall. And then shift your weight forward. Well, you don't have to angle like me.
Oh.
Okay. Shoulders facing me, and then shift forward.
So should this be straight?
It's fairly straight. Right there. Do you feel it?
Yeah.
Now get tall.
Oh, while I'm forward?
Yeah. There, you should
Yeah.
open up that hip even
Yes.
more. Okay, good. And then now you kind of just rock back and forth into it. Deep stretch, then come out. Deep stretch, and then come out. Because when we sit in that cross-legged position, that referral pattern that you're having could easily be from the glute, but it also could easily be from a tight hip flexor, which, judging with your back stuff and how often we spend on the ground seated in a seated position, I want to unlock this bad boy.
Okay.
I want to lengthen it, get tall with your body. You could feel the difference when you're tall. Because it originates in our lower back, when we extend our back more, we get a bigger stretch.
Okay.
So shift forward and then extend, open up to really exaggerate that.
Oh, yeah. Okay.
Feel the difference? A couple more reps there. It's really neat that we can do a lot of this stuff on the ground because you spend a lot of your day on the ground. Okay, switch it up. I'm really curious what the difference that you feel side to side here. Now, if you don't feel a difference, that's great.
I mean, this feels good.
Okay. Do you feel like there's a tightness difference side to side or no?
I feel like when this leg was up, it was tighter.
On the left hip?
On just the movement. This was like not as smooth.
Oh, okay. Very interesting. Good. So that's why I wanted to do the lunge. You can kind of tell this was the lunge position, but with your toe, it's okay. A lot of people have that limitation into the great toe.
Sure, they didn't know about.
Yeah, we didn't know until we checked the strength of it. Feel good? This is a great stretch. Okay. Great stretch. So the moral of the story is that we're able to progress the nerve glides. Now you're seated and have a poorer posture, but you're able to pull more onto the nerve.
Yes.
And we're going to start opening up that hip so you don't feel as restricted from the right hip when you're sitting on the ground. Okay. And then after we open things up and loosen it up, we have to strengthen the system, right? And so that's how we keep everything that we get. Okay. Is those little improvements that we notice start to accumulate once we can strengthen into it as well. Okay. And then so we're going to add lateral lunges, and we're going to revamp the program just so things are a little bit harder, but you don't have to do quite as much. Okay. And so the slumps, the glides are a little bit harder, but now you don't have to lay on the ground to do it. You could do it in seated position. In the lateral lunges, and we're going to open up the hip flexors, and we're going to follow that with some good hard strengthening. Okay. And the achiness and that area that you're feeling in your lower back responds very well to everything that we're doing. Yes. It's just today was a little bit different because you've been doing a little bit more, right? And that's the whole point of all this, is just increase your threshold of tolerance. Okay. And that when off days like this do happen, or off days like sitting in a car for 3-4 hours, or total sitting of 6 hours in a day, your body's at least able to respond well to it. Yes. And doesn't take as long to recover either. Okay. So, right, it's resiliency as well. Yes. And shortening up the program means we're a little more compliant with it, right? We're able to do it a couple times a week to really dive into that, into your body, to really have that long-term change. Yes. Sound good? It does. I know it does feel like we're tackling a lot. We kind of are.
I feel like I'm sore through here. Like when I started, the isolation was here. Yep. From probably just the moving today.
Yeah, yep.
And now I feel after working that it's like, oh man, I could tell I worked it.
Okay, I'm curious how you...
The hamstring isn't making me uncomfortable because my eyes are here.
Oh, okay. Yeah, your body concentrates on one thing, right? Yes, and so we're really doing well with the left side. Now getting this, right, muscles respond a little differently than nerves, so we're going to see how it goes, especially how you respond over the next 24 hours, because I really got into a deeper range of the hip, and so we're going to see how that goes. Okay. Sound good? Yeah. Overall, I like it. Okay. You feeling good?
I'm feeling a little sore right now.
Classic, right? This is the nudging your body in that recovery direction, and so we kind of have to poke the bear a little bit. Okay. But with you, I'm not that concerned, because it's not like even when you are sore, you're not laid up, right? You're just sore, and so we can kind of do a little bit more and nudge you a little bit faster.
This has never caused me to be, some of it's because I'm stubborn. Sure. But it's never caused me to be like, I can't do it. Now at the end of the day, I can be like, I really just need to not move anymore today. Yeah. Or I get up and I'm like, oh man. Yeah. I'm slower to move. Sure. But I'm not the injured that's like, I can't get out of bed today. Thank goodness. Yeah.
Yeah, no, that's not you at all. Which just gives us a green light to do a little bit more. Yes. Which just makes this process that much more fun. Right? Okay, so we'll update the program and we'll go from there.